and we're going to talk about what are the contributing factors to surgical complications in general, not just the ones that are related to heart. So sometimes you might hear about there are some complications that happen after surgeries. They are kind of rare. You must not get scared. Um, you might hear about someone got an inflammation, or there is some pus going from their incision, or etc. So one of these, let us say, complications is related to your brain and to your from a neuropsychiatric perspective, which is going to be hallucinations. So for me, I have been working on a research for, let us say, 2 to 3 years, and it is currently under a publication process, and it will be published soon this year. One of the sources that we relied on during our research is the source that you see here in the slide. Risk factors for delirium after coronary artery bypass. We relied on this one during our literature review and during our, let us say, learning process about cardiac surgeries and what might happen after them. So, what are our objectives? Today, we are going to define and describe hallucinations in general. We are going to talk about the hallucination types and incidents. Incidents mean the number of new cases that you might face. We are going to explain proposed pathophysiologic mechanisms, the step by step of a disease to happen. So, to think like a doctor, you are not going to study a disease and its symptoms or treatments. You're going to study a disease as, let us say, steps on a cellular or molecular level. This is what is pathophysiologic mechanisms term mean. You are going to study, you have the cell, there is a defect at the cell. Let us say the DNA is disrupted, or there are risky atoms around it, etc. So these are our objectives: to study the pathophysiologic mechanisms that lead to hallucinations after cardiac surgeries. Okay, we're going to also identify the risk factors and go broader to surgical complications in general. And then we are going to summarize how to prevent these conditions, okay, according to your understanding of the mechanisms that we will learn. So first, about background. You must know, before everything, before we get deep into this, that you must not get scared of surgeries because you might hallucinate after um, having any surgery. Because hallucinations in general are kind of rare. They happen within 20 to 30%, as written here, after cardiac surgeries in general. Furthermore, they are self-limited. They are really transient for 1 to 3 days, let us say, and they are not that risky thing to get scared of. Okay. So in general, what, how, what, let us say, what does cardiac surgeries affect on your brain to develop hallucinations? So you have your brain. Your brain have a lot of regions. You have a region here that control your mouth, for example. You have one here at the side of your brain that controls your ears, what you hear, and your understanding of what you hear. You have here, let us say, at the back of your head, I can't point specifically, but at the back of your head, you have a region that controls your eyes and what you actually see. So these are the regions that might be affected after cardiac surgeries, especially cardiac surgeries, that may lead to a state of delirium or hallucinations. You can't realize exactly what you are saying, or you are seeing something, let us say, kind of strange. We said you have a lot of regions in your brain, okay? Let us say that simply. You have a lot of regions. Each region is responsible for something. So when the region that is responsible for controlling your eye is affected, you might start seeing something strange. You might start seeing moving objects, or let us say you might start seeing fire. If the region that is responsible for controlling your brain, your ears, you might start hearing weird things. You might start, for example, a lot of patients at our clinic start saying, "Oh, we are hearing there is a baby crying. There's someone saying really weird things to me." So these are all states of hallucinations that might happen. Okay, and again, they are not that risky thing. They are not that scary thing. They are short lasting and self-limited. Okay. So, what are the proposed mechanisms or the steps into developing these hallucinations after cardiac surgeries? How do they especially happen? And then we are going to conclude for them how to prevent these hallucinations after cardiac surgeries. So, I have my whiteboard here. Um, I will try to draw on it. Okay. So the first mechanism we have is neuroinflammatory response. Um, so why surgery? You, surgeons are using, let us say, metal tools, okay? And they are sometimes, during surgeries, they might cause a minor trauma to your vessels. Okay, so this trauma is not like cutting off your whole vessel. No, it's like rubbing the vessel, let us say the wall of the vessel. So it is also called a minor trauma. Okay. Again, I'm going to try to draw a vessel here. And during surgery, a minor trauma might happen to the wall of your vessel. So your body is going to say, okay, I might be in danger. Your body is going to think that there is kind of attack to the vessels. So in order to defend itself, there is going to be a neuroinflammatory response or an inflammation. So one of the ways in order to protect your body is called an inflammation. Inflammation works by activating white blood cells and platelets. To state this simply, white blood cells and platelets, they are like the soldiers of your body, and they try to defend your body against anything strange, let us say a virus, a bacteria, etc. So in order to defend the body, you have these cells are going to start working, which is called an inflammation. So when a minor trauma happens, your body might think, okay, I might be in a danger. So these are going to start working and are going to attack this trauma and try to repair it. Somehow these cells can make their way to your brain, okay, and affect your brain and affect the regions that we talked about that controls your eyes, your ears, and your mouth. How can these inflammatory cells, the white blood cells and platelets, reach your brain? Actually, there is a really fast way from the heart to the brain. So you know that the heart is connected to a lot of vessels. One of them is a vessel connecting your heart to your brain called a carotid artery. Okay, this is just for you to know if you want to know the name of that vessel. So the carotid artery connects your heart to the brain like this way, and so your inflammatory cells can go from the heart to the brain and affect the brain as we talked about. Okay, so this is the first proposed mechanism. Again, these are all theories and a lot of research is being done on them. One of them is my research in order to discover what is the most likely mechanism for them. So first, we have a neuroinflammatory response. Your body might think it is in danger and start this whole inflammatory process. Next, we have a neurotransmitter imbalance. So what is a neurotransmitter imbalance? To state that as simple as I can, your brain is part of your nervous system, right? And in order to have any instruction or in order to move anything in your body, in order to have instructions in general, it will send signals. Okay, so it will send a signal from the brain to my hand so I can move my hand like this. Okay, these signals that are going from the brain are called neurotransmitters. Okay, um, neurotransmitter imbalance mean sometimes the patients are given certain drugs in order to protect them from inflammation or because of a certain state, maybe a problem in the liver or something. They are given drugs that can affect the balance of neurotransmitters in your body. So there is a problem in the neurons that are in your brain, and thus the signals going from the brain to your eyes, to your ears, to your mouth, etc., might be disrupted or there might be an imbalance on them, a deficit in them. For you to know, these neurotransmitters, they are really various, and one of them is dopamine. If you heard about dopamine before, you have also acetylcholine. These are type of signals that can go from your brain to your body parts. The third mechanism we have is cerebral hypoperfusion. What is cerebral hypoperfusion? It's a really interesting one. So let us say, I'm going to simplify it as having a pool of water, okay? So when you have a pool, and let us say, for example, a pool of water, and you are splashing it with your hand. When splashing with water, you you are going to notice some bubbles forming, okay, and also you are going to notice some water droplets collecting with each other, forming a huge droplets. Okay, this is like a stimulation of what happens at your vessels during surgeries. So during surgeries, let us say a surgeon might do something to your vessels. It's not surgeon's fault. It's just something that might happen. It's kind of splashing with your blood within the vessel might happen, and thus some bubbles and some huge droplets might form. The droplets are not huge into your vessels because your vessels are really small, and thus smaller droplets might form. So we're going to call them bubbles, okay? And the huge droplets, I'm going to name them, let us say, a microemboli. Okay, what is a microemboli? When some blood droplets collect with each other, they are going to form actually a clot. This clot in medicine is called, in medical terms, is called an emboli, and micro means really small. So some bubbles and some microclots might form in your vessels. Okay, so we are in the heart, and the vessels of the heart are not that narrow. So when these microemboli and these bubbles are moving, let us get here, from your heart to your brain, they are going to reach a really thin vessels at your brain, especially at the regions controlling your eyes and the regions controlling your ears. They are going to reach them and kind of occluding them, and then your patient is at risk of having a hallucination. Okay, they're not going to occlude them forever. There are going to be more blood coming after that, and this blood is going to kind of wash them out. So that's why it's a transient period. It's for 1 to 3 days. It's not long lasting thing. Okay, so we have the neuroinflammatory response, the neurotransmitter imbalance, and the cerebral hypoperfusion. There is something I didn't mention before, is that before moving to point four, is that your brain is not just present like that in your head. Okay, it's not unprotected. There is something surrounds your brain, okay, called, here is your brain. I'm going to write it so you don't forget it. A blood-brain barrier. It's a barrier, again, a blood-brain barrier. It's a barrier that protects your brain from anything harmful that might reach it. Let us say as infections, viruses, bacteria, and it allow only three things to enter. Let us say it will allow anything that is made up of lipids, because sometimes your brain is going to use these lipids as source of energy. Also allow only gases and some blood components. Okay, blood components. These blood components, we are going to say the red blood cells, because you will of course need red blood cells at your brain. You have lipids and gases, the only things that can enter your brain. Okay, so during surgeries, you want the patient to sleep, right? Or after surgeries, some patients want some painkillers to relieve their pain. So they are given drugs either to let them sleep before the surgery start, or drugs in order to relieve their pain. These drugs are called opioids, as you see here, or anesthetic agents. Again, they are just drugs to let the patient sleep or remove their pain. In order to let the patient sleep or remove their pain, they are going to affect what? They're going to affect your brain, right? So, in order to affect your brain and to relieve that pain, they are made up of lipids. So, they are made up of lipids so they can cross this blood-brain barrier and reach your brain and thus relieve your pain or let you sleep before the surgery. Okay? So these drugs again can cross the blood-brain barrier and let you sleep. Okay, and then sometimes for unknown reasons they go to different regions. Let us say by accident they can go to the regions that controls your eyes or your ears, and thus propose the patient to have a hallucination after the surgery. Okay. And to point out something, you have here gases. As we said before, in point 3, some bubbles might form. And these bubbles can enter your brain because they are made up of gases. Okay? And you have here some blood components as the microemboli, which are already red blood cells collected to each other. Okay? So these 4 points are proposed mechanisms of having hallucinations. They are thought to cause hallucinations after cardiac surgeries. A lot of um, a lot of research is being conducted on these mechanisms in order to understand which one is true. Maybe points 1 and 4 are true, 2 and 3, etc. There are a lot of um, curiosity in this. Okay. So, what are the risk factors in general? So, this slide is, let us say, from a public health perspective. So, some institutions, let us say, as the WHO and the UN, the United Nations, and etc., these institutions are concerned of just having kind of statistics on the population, like just counting number of cases of a certain disease as flu or coronavirus or etc. So these institutions did a kind of statistics on populations worldwide in order to calculate these patients having hallucinations. Most of them are found to have an advanced age, as you see here. If I can draw, I will try to draw here. Okay, I can't draw on the slide itself. Okay, so most of patients are found to have an advanced age. Why? There is no why in this. It is just a statistical thing and thus thought to be a risk factor of having a hallucination. Furthermore, most of these patients who hallucinate after cardiac surgeries are found to have, not all of them, not 100%, but a huge percentage of them have a pre-existing psychiatric conditions. And the third point is sleep deprivation or sensory deprivation. Let us say they have a disrupted sleep schedule. Okay. Surgery related also, um, the longer the surgery is, the more the risk of having a hallucination. Why? Because it is thought that the longer the time you spend in the surgery, the more bubbles might form during the surgery and microemboli might form. We are referring back to point 3, and thus the more risk of having hallucinations. Okay. Also, from a public health perspective, they found that most cases are related to having a decreased temperature at surgeries, hypoxia or hypotension. The patients do not, they just rest at the bed, they do not move well, they do not breathe air, they just refuse to open the windows or etc. And we have high dose sedatives or opioids. As we said before, some drugs can cross your blood-brain barrier because they are made up of lipids. And thus, the more drugs you take as painkillers after the surgery, the more the risk of having um, hallucinations. Okay. Um, Broader factors in surgical complications. Okay, so we have now finished talking about hallucinations that happen after cardiac surgeries. We discussed the possible mechanisms that can lead to them. Okay, but there is, in other researches, they state that some patients hallucinate after surgeries that are not on their heart. They are not cardiac surgeries. So, from the proposed mechanisms that we said before, which one of them can be applied to any surgery might be done on your body, not just the heart? So, let us start with saying the anesthesia. Taking any kind of drugs, opioids or something as painkillers Maybe you did a surgery in your hand. Some patients take a painkiller. So these painkillers might propose them to hallucinations rather than it is not a surgery on their heart, right? Any systematic inflammation might happen. As we said before, inflammation is a defensive mechanism to protect your body. So any inflammation happens during any kind of surgery might propose patients to hallucinations because they might affect your brain. And three is longer ICU or hospital stay. So this point is unique. After the surgery, the time that you spend after surgeries, let us talk about developing countries. Some countries really do not care about patient let us say, is the patient resting well? Is the environment well? Are they breathing well? Or let us say, um, is the place calm or something? Sometimes nurses themselves do not care about them, so they might, let's say, freak out or just um, they are really annoyed from the environment they are in. Furthermore, some patients are put in shared rooms, and there are a lot of children and visitors and etc. These things are also thought to let the patient enter into a psychiatric condition. So that's why in medicine, which we are going to talk about later, we not just care about treating the patient, we care for treating the patient and is the patient well rested. You are dealing with humans at the end, right? So what how are these different from what we discussed before? The four mechanisms that we said here, they are related to heart because the heart is connected with a brain, and all of them apply to this picture that we said before. Like the neuroinflammatory response, the inflammation can go from the heart to the brain. The neurotransmitter imbalance can be due to drugs given to the heart that reach the brain, and etc. But some shared mechanisms that can affect the brain is having these painkillers after surgeries and also any inflammation that might happen. Okay, so let us think like doctors. Um, you now, let us say, know the basics of the pathophysiology thing or the step-by-step thing that we said before of how to develop a hallucination or how hallucination, sorry, develops after cardiac surgeries. So how can you prevent them? We said before, having opioids, right? I'm sorry for this. Taking opioids or painkillers can propose you to have hallucinations, right? So we can advise patients to not take a lot of them because they affect your brain and thus you might enter a psychiatric condition. You can, let us say, keep watching the brain's status during the surgery. Um, let us say some biomarkers in your brain can tell you that okay, your brain might be at risk of having clots or having might be affected during the surgery. So you must keep watching the brain, maintain cerebral perfusion. As you see here, maintain cerebral perfusion is like to maintain the brain takes well oxygen, so it is not affected. Optimize sleep-wake cycles. Patients must sleep well. As we said before, a lot of them are found to not sleep well, so it is a risk factor for developing um, hallucinations. And family reassurance and psychological support, because we said sometimes patients are not dealt with as humans. Some doctors unfortunately deal with patients as just cases and they don't care about their feelings. So it's kind of um, a lot of, let us say, institutions are advocating for this currently. Here is a summary if you want to read it or screenshot it. Let me just state them really quick. You have hallucinations, can happen after cardiac surgeries. They are kind of common, from 20 to 30%. They are transient and multifactorial. Multifactorial means they might be caused by more than one um, cause, right? Driven by inflammation, neurotransmitter imbalance, cerebral hypoperfusion, and also the intake of painkillers after surgeries. They can overlap with post-operative delirium spectrum. Patients can enter a state of hallucination and delirium, which is a subtype of delirium. We didn't state about delirium. Delirium is like being confused and not understanding what is happening around. It's kind of you are talking with them, you're asking them certain questions, but they are not replying with correct answers. And prevention depends on what we stated before, how we connected the mechanisms with, let us say, with the solutions. Okay, here is another source if you want to screenshot it and try to read it. It's kind of advanced. We tried here to simplify things as much as we can, so you might understand this one. Okay, here are the main references that we relied on during research. The major one we discussed during this lecture. We are going to step through medicine journey in general. So what we can it's like a conclusion of all what we have said. What um, from our discussion about cardiac surgeries and how they can lead to certain hallucinations, how we should really understand the pathophysiology thing of them. Again, what is the pathophysiology thing of a disease or a condition? Here it is a condition because it's a hallucination thing. Um, Understanding how they exactly happen can help you treat them even if you forgot what is the medicine that should be given to them. So studying medicine in general is really interesting and really exciting thing. Let us say it's kind of a long journey. Let us said here, it's kind of long journey, okay, but actually you are dealing with humans and you are not dealing with just a case, right? During studying medicine, I want just to give you a really cute advice. You should not just isolate yourself and just depending on, okay, I must study 24/7. It's really hard, it's really serious, etc. No, again, you are dealing with humans, and a huge part of medicine is means communication. Okay, I'm sorry. A huge part of medicine means communication. And again, you must take care of the patient physically, mentally, and be yourself. Exactly. You must be yourself and keep exploring and keep curious about everything in medicine. So you should not just study and be like a robot. Okay, you have a cancer. I don't care. Just take that treatment and end of discussion. No. In order to develop your communication skills, it is also advisable to volunteer, to keep reading, stay curious. Okay, someone discovered a new treatment, let me read more about it. And most importantly, communication really matter in medicine. Okay, so again, as we said before, medicine is more than memorization. Again, you are not just studying a disease, its symptoms and treatments. It is a really wrong way to study medicine. You must study it from a pathophysiology thing, the steps of a disease, how does it occur on a cellular level. Again, you have a cell. This cell might be injured for certain reason, maybe certain chemicals. Then there will be a lot of complications that may lead to a real severe disease. So you can treat it by what? By solving. You can solve the problem by getting rid of what caused that problem. Okay, so you must understand every why. It's not a must, but it's like solving a puzzle. Okay, and build logic and critical thinking and try to build your own. If you want to be a researcher in the future, you must always learn everything on a cellular level, again on a pathophysiology thing, so you can have your own hypothesis and make your own solutions. And thus we step here. The medical areas of medicine can be about science. You can study medicine because you love science and because you love, let us say, certain areas in medicine as genetics, Maybe there is global health and advocacy, as we see here. But I want to link science and academic ways together. So, if you want to study medicine to be a scientist and having your own research and your own hypothesis, this can lead you reach certain academic objectives, as being a professor or having your role at university as a teacher or something, because research can let you be a certain professor. For example, there are a lot of professors, especially in cancer, because cancer is really undiscovered, and a lot of people really want to know what is the treatment of cancer. So there are a lot of professors in cancers. Why they are called professors? Because they work, let us say, for 10 years, or they have a lot of papers and researches about cancer, right? Global health and advocacy, it is the same thing as we said about WHO and UN thing. These are institutions, you can join them and, let us say, advocate and spread awareness for youth, for children, for school, for population. For example, during your statistics, you found that there is a new virus, for example, coronavirus. What happened at coronavirus? What was their role in global health and advocacy? To tell us to stay, to keep our hands hygiene, to wear a mask, to get vaccinated, etc. And there's also the healthcare part. The healthcare part, as you already know, working at hospitals, at clinics. So we can summarize your role in medicine in general, as you learn from surgeries in heart. Let us imagine the past presentation about cardiac surgeries and etc. as an example for you about medicine, how understanding things from really tiny details can lead to certain solutions and certain interventions that your patient will stay well rested at the hospital. So you can advocate for any findings you have. You can share research and spread awareness. You can connect with people and understand their stories. And you can go through many paths as surgery, research, and public health or advocacy. Thank you so much for listening.